President Obama, an exact quote to the joint session of Congress when he was promoting this legislation, not some off-the-cuff figure, said this: "Now, add it all up, and the plan that I'm proposing will cost around $900 billion over 10 years. Now, this was a deliberate attempt, as has been suggested, to manipulate the figures because the taxes started right away, but the spending was 4 years delayed, essentially. And they've misrepresented the cost. It's far higher than anyone has expected, and it's going to continue. For example, our people have looked at the CBO score on the Budget Committee, and they've analyzed it fairly, and I'm prepared to defend these numbers based on CBO scores from 2014, the first year the law is really in effect, till 2023. It will cost $2.66 trillion, far more than was projected. How much money is that? Over the same 10-year period, on federal highways, we'd spend $626 billion. Education, the education we expected to spend over the next 10 years is $1,000 billion. Disaster aid, we have disasters. We spend a lot of money on disasters. It's expected we'll spend $111 billion on disasters, whereas we'll spend $2,600 billion, $2.6 trillion, on the health care bill. This is the kind of thing that the American people are asking us, are you crazy? How can you borrow 40 cents of every dollar you spend as we are doing today? How can you do that to America? What's the matter with you people? Oh, they say people are back home, they're not smart, they're just angry. Well, aren't they right to be angry? We're adding a program that's financially unsound, that's going to make health care worse, and we don't have the money. This money needs to be used to save Medicare and Social Security, programs that are already in great jeopardy. As the CBO director told me in a letter, December 23rd, the night before we voted, you're double counting the money. No wonder this country is going broke. This isn't extra money. Half of the original estimate of the bill, $900 billion, was funded by borrowed money from Medicare. The point is that the bill is not good health policy. The American people oppose it overwhelmingly, and absolutely we do not have the money. We've never had a more systemic debt threat to America, and it's just so painful to see this happen.